the successful conservative treatment of Dupuytren's contractures with a new dynamic extension orthosis. No conflict of interest. Ladies and gentlemen, the idea of developing an orthosis to straighten fingers is based on the existing knowledge that fibrous cords can be stretched. Adams, Messina, and Ag used this in the past. Passive stretching demands significant time and patience from the patients. It is, therefore, essential that an orthosis is comfortable. If it causes pain, ulceration, or is too bulky, it will be quickly discarded. The inventor of this new dynamic orthosis is himself a Dupuytren patient with a high fibrosis diathesis and a rapid recurrence tendency. This proved to be an advantage when developing the orthosis, as design alterations could be quickly evaluated for their effectiveness. Findings were presented in 2019 at the International Congress in Berlin under the chairmanship of Gary Pess, Boston, USA. The inventor found that moderate traction from the extensor side of the hand in a few sessions per day over several hours was very effective. 2 years ago, the inventor involved the company NEA International, a developer and manufacturer of push braces. Together, they are developing the inventor's concept into a product that can be available to all patients. This video, provided by NEA, shows the dynamic extension orthosis in action. The functional parts of the orthosis are positioned on the extensor side of the hand. On the proximal phalanx, there is a comfortable connector that connects the distal leaf spring package with the proximal leaf spring package. Both leaf spring packages bend around the joints without touching them. The construction is such that no pressure is exerted on the joints and a hyperextension in the MCP and dip joints is avoided. The dynamic extension orthosis is recommended to be used several times a day for 2 to 3 hours at a time. While wearing the orthosis, the patient is able to bend and use the fingers to carry out small tasks. Furthermore, the orthosis does not cause stiffening of the joints even after hours of use. 31 patients were involved in the last test series, nearly all of which had residual or recurrent contractures in the MCP and PIP joints following a PF or PNF. Very few patients had no previous treatment. At the time of submitting this presentation in August, the patients had been using the orthosis for 8 weeks, halfway through the case study. Whilst wearing the orthosis, patients were free from discomfort and able to carry out small tasks. This resulted in a positive feedback, as presented in this slide. After just 8 weeks, a reduction in the angle of contraction was observed in 58% of the joints. The graph shows a straightening of the PIP joints between 10 and 50 degrees per PIP joint in this group of patients. The angle of contracture was measured before treatment and at weekly intervals directly after wearing the orthosis. The inventor found that applying moderate tractive power over several hours was more effective than using higher tractive power over shorter periods. Sometimes, however, it is necessary to add additional leaf springs when there is no further improvement, as with the ring finger of this patient after 4 weeks and the little finger after 6 weeks. Case C shows the straightening of a previously untreated little finger. A remarkable result. The inventor discovered that after months of treatment with a dynamic orthosis, contractures become fatigued. This leads to a reduction in treatment time and frequency. Thank you very much.